Well, good morning, everyone, and welcome to the Medicare Updates presentation. Thank you for joining us today. Our presenter today is Cindy Phillips, Shine Program Director at the Executive Office of Elder Affairs. The subject matter experts joining us today is Sandra Bowden and Kathleen Gouveia from Shine. Now I'm going to turn the presentation over to Cindy Phillips.
Good morning, everyone. It's a pleasure to be here, and I thank MTF and UMass and Mass Health for inviting Shine to give you an update about Medicare, which of course includes what recently happened during open enrollment this past fall and what we're looking for in 2021. As Sue mentioned, there are two additional Shine experts on the line with me, so we hope to answer any of the questions you might have after the presentation. Thank you, Sue. All right, you might be wondering what SHINE stands for, and it stands for Serving the Health Insurance Needs of Everyone with Medicare, and that means of any age with Medicare. It's federally funded by the Administration for Community Living, but we also have two other grants, and one is from the Duals Financial Alignment Model, which you may know as OneCare for people 21 to 64 years old with Medicare and Mass Health. And we also receive a grant that helps us with our public benefits outreach and assistance from the Medicare Improvements for Patients and Providers Act. The mission is to provide no-cost and unbiased health insurance information and counseling to residents with Medicare and their caregivers, but of course, we often help people with the transition to Medicare, people who are retiring from their employer job and now will be going on to Medicare, people with Mass Health who age into Medicare at 65. It's very often that we're helping with transitions to Medicare. There are 13 regional offices, and we contract with Greater Boston Chinese Golden Age Center for statewide coverage for people who speak the different Chinese languages. We have or had over 500 locations. I think most of them are at people's homes right now, but generally we do cover the state very well. There are approximately 650 SHINE counselors, and 60% of them are volunteer. And in fact, 60% of them are over 65. So they really know the Medicare population and get to meet them readily in their communities. The phone number you see there, 1-800-243-4636, is the line for Mass Options. And this is the central phone line for aging and disability services, and they can give the caller the actual regional office that they're calling, that their zip code says they should be calling. Shine@mass.gov is my direct email box. So if you have any questions or suggestions, feel free to email me those. Thank you. All right, as you can imagine, we're all remote right now, but we're continuing to assist Medicare beneficiaries to understand their Medicare and Mass Health rights and benefits and all public benefits that touch people of a certain age. We educate beneficiaries about their health insurance options and about the resources to help them pay for that care. We feel that people who have the best health care and drug coverage are probably going to be healthier. And that's really our drive, is to make sure that they're as healthy as possible and able to be part of the community. We always screen for public benefits, state and federal, and assist as applications as needed. But I want to let you know that we have maybe only 10 certified application counselors. A lot of counselors do applications, but not all of them do. So if you have any questions about that, you can speak with me or the regional office. Thank you. Before I get into what Medicare is, I just want to say that we'll be going over a lot of information, and we have a more extensive training than most state offices. It's about 40 hours. We have monthly counselor meetings, a recertification process, an exam every year. Because this information is technical, It's confusing and it becomes more nuanced as you go along. So we do have to constantly reinforce it with our counselors. And while I'm putting in a plug for counselors, if any of you are interested in becoming a SHINE counselor, we are looking at training in the spring. And of course, we do presentations for groups of professionals, if anyone's interested in that. Okay, so what is Medicare? Well, it's a federal health insurance program. It was established in 1965 because, as we all know, most health insurance is connected to our jobs. You know, we've seen people losing jobs through the pandemic and have no health insurance coverage. If they didn't have Medicare to go to when they were 65 or over, then they wouldn't have health insurance. So that's what Medicare is designed to do. Increase financial security for older Americans and provide that health coverage. It also helps people under 65 who've been deemed disabled for 2 years, as I'll explain. It's not comprehensive. There are gaps in all of the Medicare coverage, and the beneficiary pays part of it. There are 3 parts of Medicare. Part A, the hospital insurance, which includes inpatient hospitals, skilled nursing facility, home health, and durable medical equipment, and hospice care. Part B is the medical insurance, and that's more for outpatient services. Inpatient and outpatient medical services and supplies, doctors' services, speech and physical therapies, diagnostic tests, ambulance services, etc., and home health. D, of course, is the freestanding prescription drug coverage. C, they don't call it a part of Medicare anymore, but they do contract with Medicare. Medicare screens them, they do quality assurance for them. So, they do oversee the Medicare Advantage plans. And these plans combine parts A and B and offer a drug plan. Thank you. All right, this is a long list. When I started back with SHINE 20 years ago, there were very few preventive benefits covered by Medicare. These are all covered under Medicare B with certain requirements. Some are free, some have copays, some have other requirements. But as you can see on the right-hand side, look at all the shots that are covered for free under Medicare. COVID-19, flu shot, hepatitis B, pneumonia shots. There's depression counseling, obesity counseling, alcohol misuse counseling through the physician's office, and a number of other important services, screening for mammograms, lung cancer screening. So when we first talk to people about Medicare, we want to make sure that we let them know that there are a lot of preventive benefits they should use. Medicare eligibility, as I mentioned, it was for people 65 years and over who are U.S. citizens or legal permanent residents for at least 5 years. They must have 40 work credits to have premium-free or free Medicare Part A. And again, if some people don't have premium-free Part A because they didn't work enough credits or quarters, they could qualify potentially through their spouse or their ex-spouse. People who are under 65 and eligible for Medicare are those who've been deemed disabled by the Social Security Commission Department and have received payments for 24 months. And I should mention that people with end-stage renal disease and amyotrophic lateral sclerosis can apply through Social Security for Medicare and receive it much earlier than wait the 24 months. So that's a benefit for that population. Enrollments and eligibility are determined through Social Security, not through Medicare, which some people find a little confusing. And the 800 number you see is the national number. The email or the website is national also. We do have regional offices in Massachusetts and throughout the country. In the past, people were referred to the national phone numbers because they all have access to this information. But during the pandemic, it has been easier to obtain assistance through the regional offices. So that information is available at ssa.gov. Like so many things now, Social Security is requesting people set up a My Social Security account so that people can monitor their benefits and check for updates and see their accounts as they go forward. Thank you, Sue. All right, this is what Medicare enrollment periods look like this year. I'm not sure if you've been keeping up with the legislation that was filed at the end of last year, but some of these are going to change in 2023, so we've got a couple of years to get ready, and they're good changes, I think. So people can first sign up for Medicare in the 7 months around their 65th birthday. I mean, you could theoretically sign up 3 months before your birthday, so it starts the first day of your birthday month, or you could sign up a couple of months after your birthday. But what it does is push that out further, that enrollment out. You can sign up for Medicare A, and again, that's hospitalization and institutional care. B, the medical services. C, which combines Medicare A and B under a Medicare Advantage plan, and Medicare D during that time. So for some reason, you missed Medicare B, or you didn't feel like you needed to see the doctor, there's another chance that you can enroll in B, and that's actually occurring right now. It's January 1st to the end of March, and people can sign up for their Medicare B plan during this time period. Unfortunately, it's not effective till July 1st, so that's a bit of a gap in coverage. But again, that will be changing in a couple of years, fortunately. Another open enrollment period is the one that we just went through, and that was in October 15th through December 7th, where people can change their Medicare Advantage or Medicare C plan. They can change their Medicare D plan or drug plan, or they can switch, from a C to a D with a Medigap, or then out of the D into the C. This is the time where everybody should be reevaluating what their last year's plan was like and what it will be like in the following year. The special enrollment periods, we have, I think it's 2 full pages of special enrollment periods, which we really like to use if people get stuck in their insurance plan. You need a qualifying event, like you do changing out of some of the Mass Health plans, and those include moving from one service area to another or state to another, retiring, and so needing insurance coverage or other types of things like that. Thank you, Sue. All right, here's a big myth. We all thought that, somebody will let us know when it's time to enroll in Medicare. It's not something that you're born knowing, that when you turn 65, ding, ding, time to enroll. Nobody informs you. The one way you can tell when you're approaching the age of 65 is you start to get flooded with mail. And I've seen that happen many a time. So it's not that people don't know they need to sign up, but they're not informed by Social Security or Medicare. And somebody must call Social Security for an appointment. It used to be in person. Now it can be by phone, or they can enroll online. And hopefully there are no questions about the enrollment or the documents required. So hopefully it will go through online. And again, Medicare and Social Security are 2 entirely separate programs. To sign up for Medicare, you go through Social Security. They can check their database. They can confirm that you've worked the 40 quarters. But once you get onto Medicare, anything related to Medicare is most likely going to be solved through the Medicare office. Oh, and one more thing about going to the Social Security office. They do make an exception for people who are in crisis. If they're, they have no shelter, they have no food, they're in total crisis, they could theoretically meet with somebody at a local Social Security office. Okay, thank you. When would you delay picking up Medicare? Well, there are a few things to consider. Medicare A, if you've been working those quarters, it's free to you. it really wouldn't impact your employment insurance. It might help fill in some gaps, but there is a time or a situation where you might want to wait to pick up Medicare A, even if it's free. If through your employment you are contributing to a health savings account, you are contributing tax-free. And Medicare will look back 6 months and sign you up for Medicare A 6 months prior to enrolling in it. So if you're contributing to HSA tax-free and you're on Medicare A free, they won't really appreciate it. So you might end up owing something in taxes. We do recommend that people stop contributing to their HSA 6 months prior to picking up Part A. And they can continue to use the funds in their account. So for Part B and D, there are penalties if you don't pick it up in the right time. And that can be a problem. And people don't necessarily know about that unless they look into it. If you don't sign up for Medicare B and you don't have creditable coverage that says you have a good enough insurance plan, it could be a lifetime penalty of 10% per year you didn't pick it up. For Part D, if you're enrolling late, they only give you 2 months to enroll once you're eligible. There's a lifetime penalty of 1% per month of the national premium if you didn't have prior creditable drug coverage. So, there are these little nuances that you do need to be very careful about. And this is what the choices look like for people who are signing up for Medicare and want to fill in those gaps. And we'll talk a little bit more about those in a minute. So original Medicare is called Medicare A and B. And on the left side, you can see you can have Medicare A and B, which most people have, add a drug plan. You don't have to add additional coverage, but you should add a drug plan. And you can add a Medigap plan. Now, what's a Medigap? I've talked about Medicare Advantage, but what's a Medigap? Medigaps are private insurances, and these are contracted with the states, the Division of Insurance. They monitor them, they approve the rates. So that's why Medicare doesn't consider them to be part of Medicare, and they don't oversee them either. And just to add a little bit of a twist to our Medigap plans, Massachusetts is one of 3 states that don't have that huge array of Medigap plans. So I don't know if you're scrolling through your Facebook page and you see, oh, sign up for Medicare G, it's only $73 a month. We don't have Medicare G in Massachusetts. So you have to be really careful about what you read and what you think is true, because Massachusetts is a little bit different. Okay, and so here's your other option, Medicare Advantage. You can have an HMO or PPO, and we are accustomed to those through our workplace. And they most often include a Part D or drug plan. So that would be Part A plus Part B plus Part D, and then there are other benefits too. And I want to mention some of the plans don't have a Part D just in case somebody has employer coverage for drugs or a veteran's drug coverage. So you don't have to take a Part D. But if you don't have one, you need to use a Part D plan. Thank you. Medicare premium. So this slide actually refers to costs, the cost of premiums, the cost of deductibles. So at the beginning of every year, if somebody goes into the hospital, they're pretty sick probably, they have an immediate deductible of $1,484 unless they have other coverage. Some people go into the hospital multiple times in a year. If they don't have additional coverage, they could be assessed that deductible more than once during the year. The Part B premium is $148.50 a month, and people need to pay that every month, and that adds up, and it increases every year. The Part B deductible is $203. That's a calendar year, so people need to pay that at the beginning of the year as well. And also, if people have higher incomes, for an individual to be above $88,000, it's higher for a couple, of course, and they will tack on an increase for their Part B and for their Part D premiums. So people are spending some money unless they look at these Advantage plans or Medicaps, and then they're still spending money. It's not inexpensive to have health insurance. Okay, thanks, Sue. The Medigap choices changed a little bit in 2020. So we've, for a long time, had Supplement 1 and Core. There are 7 companies in the state that offer Medigap plans, and they all offer Supplement 1 and now Supplement 1A and Core. Medic's Choice was offered through Blue Cross and Blue Shield, but not too many people went into the program, so they decided it was not a great idea to continue that. Supplement 1 covers almost all of the gaps that Medicare has. You know, the hospital deductible, the premiums, co-pays, and Supplement 1A covers almost the same exact coverage except for that Part B deductible of $203. So again, Supplement 1 is available for people who were eligible for Medicare before 1/1/20 of last year. You know, people I have deferred getting on to a Medigap, they were eligible before that, they could do it. After 1/1/20, it was either Supplement 1A, and they pay the deductible for Part B, or a Core. And Core it's basic, it's less expensive than a Supplement A, but what it doesn't cover is that hospital deductible of $14.84. All right, I think that's it for the slide. What's Medicare open enrollment? So that's the period that we went through again in the fall. It's the one time of year when all people can review, compare, enroll, and disenroll. What they really need to do is make sure they're monitoring their mail, open the letter from their health insurance company in September, the annual notice of change that will tell them what's happening to their plan. Health insurance plans have the option, as you know, to change the formulary they're covering, to change their benefits, to increase rates, to add tiers of drugs, to recontract with pharmacy benefits managers. You know, some of the providers change. So a lot of that does happen in anticipation of the January 1st restart of the health insurance plans. And this happens with Part C, Medicare Advantage, and Part D plans. And I'll show you an example of a couple of the changes in a minute. So here are the dates. It starts October 15th. It used to go, and it goes through the 7th. It used to go through the end of December, which is a nightmare for Shine. And the coverage actually begins January 1st. Why is open enrollment so important? Well, because people's health needs change. During the year, people might develop some sort of illness or condition for which they need physical therapy, they need nutrition counseling, they have an expensive new medication, and they weren't able to make a change because they were locked into their plan last year. This is the time to find that plan that will better cover their prescriptions and their health care. You've probably seen that there have been really expensive medications. People are complaining about them, and this is the time to see what the options are. They can change every year. Providers change their contracts, preferred pharmacies. This can happen even during the year, to tell you the truth. So that's really generates some work for Shine because the health insurance companies do change, and so do the providers. This is a good opportunity for people to save money and ensure proper coverage for the following year. Just as an example, we're still working on collecting our data, but one of our regional offices already looked at their data, and during that open enrollment period, they helped their people, their consumers, save $2 million on their plans that they will have in 2021. So we like that. We think that's pretty cool. Next slide. Okay, and there's another open enrollment period for Medicare Advantage participants. And again, this is for people who have a Medicare Advantage plan. They can make a change. They can change to a different plan. You know, say their physician, like Martha down at the bottom of the page, belongs to a medical practice, and they drop Martha's Medicare Advantage plan on February 1st. Well, now what's Martha going to do? She likes this doctor. The doctor finally gets her, you know. So she's going to try to follow the doctor, but not if the doctor's practice doesn't accept her health insurance. So during this time period, she can change to a different health insurance plan, or even get off Medicare Advantage, go back to a Part D plan, and pick up a Medigap if that's what she wants to do. And we're fortunate in Massachusetts, and I neglected to say this, but we are one of the very few states that have a continuing Medigap enrollment opportunity. It's not once a year, it's not twice a year, it's all year round. So this really helps somebody like Martha, who would be in a tough situation. Okay, and I think I mentioned this, what you can't do during Medicare open enrollment. Well, again, you have to be in a Medicare Advantage plan to make any change at all. So if you have a Medicare Advantage prescription drug plan, you can't move to a different one. You can't move from only having a drug plan to buying a Medicare Advantage plan. That's not an option for you. Thank you. All right, the Part C and D special enrollment periods. Again, as I mentioned, we have a 2-page list of all of the options to change. You can enroll, disenroll, change Part C or D, but you do need a qualifying event or circumstance. During this public health emergency, there was one in existence in 2020, and now that has sort of dried up. But again, you know, we work with case managers at Medicare to help people who have circumstances beyond their control they need help with. The length of the time they have to make a change varies depending on the event. And if somebody had a penalty because they didn't sign up for Medicare B in time or D in time, they'll still carry that, even if they get a special enrollment to make a change. There are 2 other important times or opportunities for people to make changes that we use fairly frequently. One is called the 5-star plan. And this can be a prescription drug plan, it can be a Medicare Advantage plan that is considered deemed qualified, so qualified that they have the privilege of offering an open enrollment opportunity or an enrollment opportunity throughout the whole year. And people may take advantage of that plan. Currently, it's the Tufts Medicare Advantage plans. We don't have a prescription drug plan this year, or a prescription advantage. And I'll talk a little bit about that later. But having that, being in that prescription advantage membership program allows you to make a change once a year. Special enrollment period for the public health emergency. As I mentioned, there was one in 2020 when it first, the emergency first started. And people who ran into certain circumstances were able to get assistance. The disaster emergency that had been used to allow this enrollment has been morphed so that now public health emergency is included in that. And people can get that going forward after 1/1/21 if it's declared again. I know that clear as mud. I think there's one more slide on that. No, but anyway, SHINE works with, again, CMS caseworkers on a case-by-case basis to solve any of the problems that might be coming up as a result of anything COVID related. And I mean people who are ill, people whose caregivers have been ill and can't take them or help them enroll. You know, there are myriad reasons why somebody didn't do what maybe they should have done to enroll in a Medicare plan or make a change. And SHINE counselors are trained to work with them to make changes. All right, so the Medicare Advantage plan premiums over time since 2017 have decreased quite a bit. So this is a point that people like to make. But the other point that we like to make, as people who've been working in the field a long time, we have seen other costs go up. There are, it's a balancing act. Insurance companies have to survive, so the premiums go down, but some of the other payments might go up. Massachusetts, there were 43 options for 2021 decisions. So that's what people had to encounter. And end-stage renal disease, again, ESRD. People with ESRD could enroll as of the 1st. A medical savings account became newly available in Massachusetts as of January 1st. Telehealth, as we saw all of last year, exploded. And prior to the emergency, it had been very limited, and people had to have audio and video. Now that was loosened up quite a bit, and Mass Health did the same thing. So now people with Medicare and Medicare Advantage plans can either have an appointment at zero cost or the cost of a normal visit, which could be $20 for their own physician or higher for a specialist. And new Medicare Advantage plans targeted veterans by offering Medicare Advantage plans without drug coverage. And you kind of had an idea of which plans they were because they were called Patriot, Honor, and Eagle. So those are some of the new changes for 2021 with Medicare Advantage plans. The Part D standard benefit, it has been changing every year. The deductible that people have to pay when they first show up at the pharmacy to get their prescriptions went up $10 from last year. Not all the plans have this deductible, but many of them do. So that's an out-of-pocket payment of $445. There's an initial coverage limit and an out-of-pocket threshold where the plan is paying about 75%, the individual's paying about 25% for their prescriptions of the cost of the prescription. And when they get to that 6,550 in 2021, then they enter the catastrophic cost sharing phase where their costs for prescriptions go way down, or they could theoretically be 5% of the cost. So this is part of what we look at every year. Medicare.gov is the website that we go to. It's the go-to place to help people figure out what their options are and what will work best for them in 121. So we look at what the whole year will look like for their prescriptions, what they'll have to pay at the pharmacy. People don't like paying a lot at the pharmacy, so that becomes part of the conversation. Okay, thanks, Sue. The Medicare Medical Savings Account is a new plan this year. It's offered under the Lasso company that has, I think, 14 other states, or plans of 14 other states. This is a high deductible plan. So what happens is the Medicare Savings Account deposits a certain amount of money in the account that's held in the bank, which you spend. Then you spend out of pocket a certain amount. And once you get up to that threshold, then services are free. You can go to any Medicare provider who accepts the plan. It has to cover all Medicare services, and it might have these additional benefits. The high deductible in Massachusetts sounds like this. So there are two types of plans that were offered. Lasso put $2,000 in the bank for individuals. Then they have to pay out of pocket $3,000 after that is used up. And then the threshold becomes then $5,000, for which then Medicare services are free. The second plan was Lasso deposits $3,000, and you pay $5,000, which gets you to a threshold of $8,000. And then Medicare services are free. I think people who've been using this kind of plan at work may be more comfortable with it than most people who have not been using it. It's a bit of a gamble, but what you have left over in your bank can be moved to the following year for medical expenses. Well, the other little thing to notice is that if you join one of these accounts, you still have to pick up a Part D drug plan. So, it's not totally free. Thank you, Sue. And now here are the freestanding prescription drug plans in a nutshell. There are 27 plans offered in 2021, not 27 different agencies or companies, but 27 plans, 2 more than last year. 4 of them had a 0 deductible, so that when you go right to the pharmacy, you start using the co-payments instead of paying the deductible. 17 of them had an arrangement where some of the tiers, like the generics, did not have to pay the deductible when they went to the pharmacy. So it encourages people to use the generics if they are offered that and if it's a possibility. So that was fairly new. And of course, the tiers, one of those, they can be generic, preferred for generic, brand name, preferred brand name, specialty, and then there was a tier 6, which were all very customary generics, and some of those were free to some subscribers. So there's, so many variations that it does get pretty tricky. And again, there were prescription drug plans for people who have extra help to pay for their drug plan. 8 of them had 0 premium, so those are very attractive for people lower income with this extra help program. Prescription drug plan changes. So again, these are the kinds of things that Shine counselors have to pay close attention to, because these can be the issues that people get hung up on either during open enrollment or in January, when they're waiting to get their drug card so they can go to the pharmacy and get their prescriptions, or they realize they've just received a bill and it's totally different from what they expected. So 3 new drug plans: Elixir RX Plus, $14.30 a month, nice and inexpensive. Mutual of Omaha RX Premium, $25.10 a month. Okay. Silver Script Smart RX, $7.20 a month, very inexpensive. During the year, Envision changed its name to Elixir. Envision RX Plus name changed to Elixir RX Secure. So people who were in the Plus were moved for January 1st to the more expensive plan, even though they might not have wanted that plan. So they need to have, opened up that letter in September and realized that now they're going to be paying $20 more a month for that plan. And did it cover their prescriptions? And what else is out there? Mutual of Omaha switched members from the RX Value plan at $24.10 a month to RX Plus, and the premium of the RX Plus went from $49 to $30. That's a jump of $60 that if they weren't paying attention, they may be shocked that happened. And in fact, we saw some computer errors that landed people in that more expensive plan. So that's what we're hearing about now. Aetna is now managing Silver Script plans, and the Part D senior savings model, which we'll talk about, came out, and that's available in 9 plans, and actually 2 Medicare Advantage plans. So here's the Part D senior savings model, which some of you hadn't heard of, some heard but needed more information, and some have heard of. It's a 5-year voluntary model for Part D and insulin manufacturers, and it starts January 1st. It provides broad access and formulary insulins, and they can choose which insulins they cover under this plan at a maximum of $35 for each month during that entire log period. Do you remember all of those coverage periods we talked about, the deductible, initial, and coverage gap, and then catastrophic? Well, it's planned so that people aren't spending more than about $35 a month. It was set up so that it will help beneficiaries save about $446 in out-of-pocket expenses a year. They can plan how much their insulin is going to cost. But again, there are a lot of insulins out there, and they can they can decide which insulin will be part of this plan and which won't. So people have to be really careful that they're typing the right insulin into the Medicare plan finder. People are eligible if they're enrolled in a participating enhanced Part D plan and they don't already have extra help because that's a better benefit. The Medicare.gov, the plan finder site, was set up so that you can actually sort for these plans, which is fine. And we would always recommend, sure, you sort for them, see if one of these 9 plans comes out as the right plan for you, but make sure you get all your prescriptions in Medicare.gov and sort for all of your prescriptions, because sometimes one of the 9 plans is still not the best plan for you. And this is what it would look like during the year. Normally during 2020, you've got that high deductible period. Initial coverage is lower when you're paying less for your prescriptions, and then it's higher during the coverage gap period when you're paying more. And then the catastrophic period, if you end up spending over $6,000, it would be lower cost. On the right side, this is the 2021 for people who need the insulins that are covered. Mostly throughout the year, it's $35 a month. During the catastrophic phase, it could be 5%, which may be lower than that, or it may even be a little bit higher. So this is a new model, and we'll see what happens with it. Programs that help people with Medicare. Shine has this chart on the next page that is public, and if you want it, we can send that to you. It lists the categories of public benefits plans that Shine counselors help people with. They help them screen, they help them do the applications most of the time, not all the time. And it lists the income and assets, what the application is, where to call to get it, and then the benefits that it covers. And of course, if these applications are online, Shine has a link for counselors to get them online and hopefully fillable. And the Prescription Advantage, I mentioned before, it's a state-sponsored plan. It's changed from the senior pharmacy program of 2 decades ago to be a plan that excuse me, helps people who are over 65 with no Medicare, people who may have come in from another country to live with their family, but because they didn't pay into Medicare, they can't sign up for Medicare D. They could join Prescription Advantage. People who are lower income and have Medicare and are under 65 could join. People who are 65 plus and have Medicare could also join Prescription Advantage. It reduces costs, mostly in the coverage gap, for some earlier than the coverage gap, and enables them to have a one-time special enrollment period every year that they could join a new plan. Okay. And Shine counselors do help people fill out Prescription Advantage plans. You can also call Prescription Advantage at the Mass Options number that you saw earlier, which is where all the Shine and aging and disability information is at Mass Options. You could go online and start to fill out the application yourself. So there are a number of times when it's really great to do this, especially when we see that somebody needs an opportunity to pick a new plan and they are eligible for Prescription Advantage. It works out really well. Okay. And again, here's a snapshot of the senior buy-in, or QIMBY, and the buy-in. Senior buy-in is for people who are lower income, but not as low as Mass Health, of course, and those are the assets and resources limited, and those are the things that it pays for. Part B, hospital deductible, copays, extra help. The buy-in or SLIMB and QI1 plans are to help people pay for the Part B premium. That income is a little bit higher. Medicare Savings Program is the kind of information that we are very interested in communicating to Medicare beneficiaries, especially once open enrollment is wrapped up. Usually the spring is where we try to get out information. We have flyers and brochures in multiple languages. And I believe last year we sent them to the League of Community Health Centers, and we'll do that again this year. And if anybody has interest in some of this information, by all means, please just do let us know and we'll get it to you. Luckily, it's a short application, so it's not mass help. Hey. And the other thing about the application is this year you can apply for the senior buy-in and the buy-in using this application instead of the Banksy Mass Health application. All right, to briefly talk about programs for dual eligibles, those are people with Medicare and Mass Health. There's OneCare, and I mentioned that Shine has a contract with OneCare to do outreach to this population and to help tell them about these services that are available to them. The reason that it was even set up as a testing program was to see if they could combine Mass Health and Medicare under one umbrella and coordinate services. People were finding that it was very fragmented for those who needed a coordinated care plan and lots of services. So they have one coordinated care team member, and there are no co-payments. The plan is supposed to be developed around the person, their significant others, and current needs for services and outside the box services, right? Prescription, dental, vision, community supports, like transportation. Some of the members we've met who have OneCare have done things like gotten a wheelchair that they can play tennis out of, or joined a knitting class that they use instead of different kinds of therapies for their hands and for their mobility. To find things that they really enjoy doing that will support their physical and mental health. There are currently only 2 plans that offer OneCare plans, and they're covered with Care Alliance, but they almost cover the state, and Tufts Unified that is in parts of Middlesex, Suffolk, and Worcester counties. The eligibility is to be of the age of 21 to 64, have Medicare A and B due to disabilities, qualify for Medicare D, and have Mass Health Standard or Common Health. If they have private insurance from a job, they're not qualified, or if they have a special waiver through home and community-based services or another waiver that they're getting a plethora of services from already, then they're not eligible for this plan. And of course, they need to be in the service area. There are numerous ways to learn about OneCare or to understand what's available to you under OneCare. We compare what's available to these two plans to what you might get through a different Medicare Advantage plan, so that you have a really good sense of what your options are. And a lot of that comes down to providers. If your providers are in Commonwealth Care Alliance or in Tufts, it might work better for you. So it's definitely what we would talk to them about. So you could call Shine or Mass Health or 1-800-MEDICARE for information, or go to those 2 plans directly. Or you could talk to my ombudsman, who I will mention a little bit later. That's the website. Senior Care Options. You may have heard of these as well. There are 6 plans in Massachusetts, and they combine Medicare and Mass Health services. Most everything is free. They coordinate social services and medical care. There are no co-payments for members. And those are the 6 plans. Eligibility is you must be 65 or over, have Mass Health Standard, live in one of the service areas of those plans. You must have A or B or both, And if you're currently paying the B premium, you must continue to pay for it. If Mass Health is paying for whatever Mass Health is paying for, they almost must continue to pay for their payments. Variety of ways to reach a SCO plan, call them directly, Mass Health, and there's the website if people want to take a look at that. The program of all-inclusive care for the elderly, or PACE, is another program that combines Mass Health and Medicare to provide services for people who would be nursing home eligible. And in fact, to get into this program, you have to be screened and be deemed nursing home eligible. But these are for people who want to live in their homes and they are safe in their homes with additional services. It's an interdisciplinary team, a healthcare plan, and a place for people to go. It's called a PACE Center. It might be similar to Adult Day Health. And you see below the service areas. Eligibility is people can be 55 plus. So as you see, it's 10 years earlier than under the SCO program. Live in a PACE service area. Identify as nursing home eligible, already live in the community, and can live safely, with some services. And I think, as we're seeing more technology used to help people stay safer, I think we'll see that happen for the folks in PACE and all of these other programs too. They must agree to use the services through the PACE organization, which may be something for people to think about if they have a beloved physician or whatever. And again, have to be deemed disabled, have Mass Health, or they could be private pay. It doesn't mean they have to go to the center 5 days a week, but there is that is an element of their care. And that's the website that describes the program. My ombudsman was once called the One Care Ombudsman because it worked with folks who had one care and who had complaints or disputes or negotiations with maybe a provider's office that didn't have the right size ramp for them to get into, or was not covering the medications correctly, or transportation was, and always is a big issue for seniors and people with limited mobility. But now it's called My Ombudsman, and it covers a lot. Mass Health, the Mass Health Medicare programs, One Care Space, SCO, and the Accountable Care Organization programs, and Mass Health. So as you can imagine, it has expanded quite a bit from the office in Malden. It's still there, but does have other resources out in other parts of the state to resolve concerns with Mass Health plans. My Ombudsman has specialists who speak Portuguese, Spanish, Cantonese, and have American Sign Language skills, which has been really helpful for the community of hard of hearing individuals. There's a video phone number, email, and website if anyone is interested in learning more about My Ombudsman. And of course, we can't talk anything about Medicare without talking about fraud and abuse, because unfortunately, that can be part of the expenses that Medicare is looking at. So the Senior Medicare Patrol, it's currently located, or is located at Elder Services in Merrimack Valley, but they have volunteers who work throughout the state doing presentations and helping in certain situations. Their objective is to reach and educate Medicare and Medicaid beneficiaries, families, professionals on opening that letter, that annual notice of coverage in September, on looking at the medical bills. We're checking to see, yes, I did have this service. No, I did not have that service. Or why is that service so expensive? Or how come that doctor is charging me? I don't remember ever seeing that doctor. Really being engaged, as they say. And then errors, fraud, and abuse. Anytime there's a situation that opens the doors for people to try to make money, they will do it. So we have seen COVID fraud cases, people tried to sell test kits, people who are saying they have the solution for solving COVID if they just give them their credit card number, excuse me, so I've seen vaccine fraud and of course brace scandals, things that have to be approved by physicians but aren't. A number of issues have come up. So if there's deceptive marketing or fraud and abuse, you can call SMP or look up information at that particular website. And here's one of the latest scam notices that have been put out. It's a COVID-19 scam, and SMP regularly produces information to go out to Meals on Wheels and to people who are getting bagged lunches so that they are aware that there are a lot of people out there who are interested in making money and might try to sell them something that sounds too good to be true, or might just want their credit card or Medicare number and it ends up in the wrong hands. So people really do need to be aware of that. And that their COVID tests and shots are free. The vaccine is free. Mass Options, I mentioned earlier, that's the number that Elder Affairs is using for all aging and disability services. They have specialists who can refer to folks who specialize in housing, food resources, caregiver supports, day, health insurance, other insurances, transport, etc. And again, that's the best way to find out which regional SHINE office covers your area so that we can connect you best to the SHINE program. You could also email me at that shine@ma.org and I will get back to you too.
Again, thank you to Cindy and Kathleen for being a part of today's presentation. Stay healthy and safe, everyone, and have a great rest of your day. Bye-bye.